A very good afternoon, Doctor. I mean, we saw those pictures from the ICU. We've seen that it was quite empty, very different to some of the scenes we've seen in previous years on New Year's Day. What is your reaction to the fact that, you didn't have to be or the staff didn't really have to be as busy as they generally are when it comes to New Year's celebrations?
I was very relieved to see those photos. Having had worked during the festive season in the past, it was actually amazing to see that. We've seen with this lockdown, it's been a blessing actually. With regards to the patient numbers, they've been in an all-time low. It's very similar to what we saw during the level 5 lockdown, and what's great about it is that we were able to, it's just been a great relief for us.
Yeah, and I mean, given this experience, and I mean, I can see the relief, and I suppose it's shared with many of your colleagues. Does this mean that perhaps going forward, that you as, a medical staff at Baragwanath might then want to support, a ban going forward on alcohol when it comes to New Year's Eve celebrations, if there is perhaps an opportunity to do so, because it has proved, actually there's evidence now that there is a causal link or direct link to the issue of alcohol and some of the injuries and even fatalities that you've witnessed at Baragwanath Hospital. Would you then be supporting those pleas or calls for a ban on alcohol for particularly New Year's? Let's just say, we're over and done with the issues of lockdown and coronavirus, but perhaps that might be something going forward. Would you then support?
Personally, I would 100% support that. It was just amazing to see what the effect of alcohol did to the trauma ICU. In terms of our numbers, and it actually allowed us to focus on the medical patients, which is what I feel the intention was. And I remember, as I said, working previously, New Year's Eve was always one of the craziest nights of the year, and again, to see those photos was just amazing. Personally, I would 100% support it. I don't know how practical it would be, but in terms of relieving the hospital and the medical burden, it would be amazing to see that.
And talking about the burden on hospitals, how are things going in terms of the people hospitalized for COVID-19? I mean, part of the issue, of course, was to alleviate that burden on hospitals. That's why we do have this curfew and a ban on alcohol. How have you kind of assessed the situation? I know you're at ICU, but how have you or what have you heard in terms of how things are going in those particular units or wards that are dealing with coronavirus patients? And maybe you can take us through just how full the hospital is in that respect. I mean, we've been hearing, of course, that many of these wards are full and there were no beds and there were a lot of issues around that. Can you take us through what you know at this time?
So what I do know is that the numbers of admissions are increasing, and that the number of wards, the number of wards that are looking after COVID patients, we're increasing the numbers of that as well. With regards to the exact numbers, I'm not too sure. Our ICU is the non-COVID ICU, so we don't really know I don't know of the exact numbers, but I know that they are on the increase. And
as citizens, what are the basic the basic role, I suppose, that we can play, right, as ordinary citizens to help yourselves as doctors, nurses, and other medical staff to stop this kind of burden that you're faced with and overworking? I mean, the fact of the matter is that in fact some medical staff have succumbed to the virus themselves. What should we be doing? I mean, of course, we're observing, most people are observing, whether it is social distancing, lockdown, wearing of masks, sanitizing, and so forth. But what more could we do really to help the doctors? I mean, you guys are really, at the front lines of this problem.
Honestly, it's all boils down to the simple basics. It's the same that we've all been told over and over again. Try to avoid large crowds, to avoid large gatherings. Keep within a small group of yourselves if you really need to see people. Try and avoid public spaces as much as you can. Please wear your mask, especially if you're not eating or drinking in public spaces. Please keep your mask on and make sure it covers your nose. The virus is shed through the nose as well. And as I said, simple things like basic hand washing is one of the most effective ways of combating most infectious diseases.
Yeah. All right, Dr. Sooka, pleasure speaking to you, and thanks indeed for all the work that you do. Appreciate your time here on SABC News, sir.
Thank you so much.
All right, that's Dr. Sooka there from the Baragwanath ICU unit, trauma unit, and of course some of you might have seen those pictures that kind of went viral of the Baragwanath ICU unit, where it was quite empty this year due to the curfew and the ban on alcohol. So just some reaction there from the medical staff at Baragwanath. All right, we'll take a short break. We'll take a look at your business news after this. Do stay with us.